Hi everyone, I'm Dr. Andrea, licensed acupuncturist and owner of Bodhi TCM Acupuncture here in Melbourne, Florida. October is Breast Cancer Awareness Month, and I am so honored to be here with Melissa Studebaker, an advanced registered nurse practitioner specializing in oncology at Cancer Care Centers of Brevard. And we're here to have a conversation about prevention, screenings, and how both Western and Chinese medicine can support patients going through that journey. First of all, let's start with your a little bit of your introduction,
Okay.
how long you've been doing this,
Okay.
and why did you specialize in oncology?
Okay, sure. So I've been a nurse since 1991, and one of the first units that I worked on was an oncology unit. And
Mhm.
it's just a unique part of medicine because it's just always evolving, always changing. Cancer treatments are just so, it just the whole field is very exciting and always challenging. And so I went and got my master's degree and my nurse practitioner's license in 2008. So I've been a provider since that time, and it's focusing especially on women's health for me is really important because I think that there's just this need for women to be able to talk to other women about healthcare and cancer especially. It's it's kind of like not a dirty word, but even today, people
Scary.
are still very scared when
Uh-huh.
they get a cancer diagnosis
Yeah.
with a great reason. But
Mm-hmm.
now there's so many new treatments available and targeted therapies and immunotherapies and new ways for us to tackle cancer that it's really become um, a disease that can be conquered, where in the past, 20 years ago, even 30 years ago, we would be having much different conversations with patients. So,
Yeah, I think that it is like the word cancer, no matter
mhm,
what comes, breast
mhm,
cancer, colon cancer, whatever comes before it, it's a very scary thing. And part of
absolutely.
that fear and the natural way that our body kind of confronts that,
Hmm.
it's shocking, right? It just it
Absolutely.
kind of there's a blockage to it. There's a force that kind of whoa.
Right.
And 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 I think that it leaves you with so many questions that you don't even know where to begin, right?
Exactly.
Where to begin that journey, what to ask, like what's gonna happen, and having that support with practitioners on the patient's journey is essential.
It is, absolutely.
Mm-hmm.
Absolutely, because, the diagnosis is the very first step in the whole, I mean, it's a life-changing word, really.
Yeah.
And so, your life before cancer and after cancer. And
Mm-hmm. It's a
so,
timeline,
absolutely, absolutely.
yeah. When you see your patients, are they already on their journey? Like,
Yeah.
where do you see
So
the
we see
patients?
patients from before diagnosis all the way until the end of their lives. So, for instance, we'll see a patient who has a family history of cancer, who's just interested in genetic testing.
Uh-huh.
Perhaps they're at higher risk for a cancer. So they come in with maybe a grandmother or a distant cousin or someone like that who's had cancer, and they want to know
They
what
want
their
to know.
risk is.
Mm-hmm.
So many times we find out that there's no genetic connection in general, and so they don't have any increased risk of cancer. Sometimes we find out that people do have an inherited gene for cancer, especially there's two that are very, I'm not going to say common because they're not common at all, about 5% of cancer patients, but they're they're more known because there's celebrities that have these genes and that kind of thing. But they're called BRCA genes,
Mm-hmm.
and they increase someone's lifetime risk of developing cancer depending on what gene they have and what type of cancer it is. So there's a BRCA1 and a BRCA2 gene, and we
Mm-hmm.
see both of these increase a woman's risk of breast cancer by more than 50%. So that's a big number. So those people aren't necessarily going to develop cancer in their lifetime, but they're at a much higher risk than the general population, which is like 12%. So we offer them enhanced screenings. So we do mammograms more frequently. We do breast MRIs. We offer them prophylactic surgery, so mastectomy before they develop cancer. Sometimes we'll offer them oral medications to decrease estrogen production, which has, in many cases, is a driver for cancer. So there's lots of things that we can offer someone who has a family history or genetic predisposition to cancer to help prevent them from developing cancer in the future.
What would you recommend people in general do
Sure.
if, like, maybe they know that they don't have a family member,
Right.
but you can still have a percentage of a probability, right,
Sure.
or of cancer presenting in the body.
So believe it or not, 75% of breast cancers have no genetic or family relation. So there's lots of women out there that need to know what they can do to keep themselves healthy. So one of the things that I think is really important that maybe people don't talk about a lot is knowing what your own breasts feel like.
Yes.
Lots of women don't do self breast exams. And I think that maybe there's an intimidation factor there. Like, I don't know what I'm doing. I don't know what I'm feeling. And really, I try to stress to people is that you need to know what your breasts feel like, so that if you feel something that's different, then you'll know, hey, maybe I need to have this checked out. So, everyone's breasts are a little different. Some people have what we call dense breasts or fibrous breasts. Other people have more fatty tissue in their breasts. So some breasts are harder, some breasts are softer. What's important is to know what your breasts feel like so that you can recognize if there's a difference. You absolutely should have a clinical breast exam. So a provider, whether it's your family doctor or the GYN, check your breasts once a year. I think that all women should have mammograms. The recommendations are to start at 40, but I feel like that number is just a guideline. I think that a woman that has a family history of breast cancer, especially if it was their mother or grandmother were diagnosed earlier in life, that they should start mammograms earlier. I think that if a woman is having breast pain or any changes in their breasts, that they should have mammogram done.
And one thing, before we go further, so and you mentioned once a year by a practitioner, but wouldn't you say it's important to know, especially as women, with the changes in hormones, the breast tissue also can change, right?
Absolutely.
So to know what's your normal way that you go through, what's the density. Maybe if you have fibrocystic breast, then you're gonna have maybe more density or maybe discomfort throughout your monthly cycle.
Exactly.
Right? And what is normal, and where something can feel a little different than usual.
Sure.
Also knowing that, right? Not only like once a year,
Absolutely.
but it's something that should be done on a regular basis.
Right. So a woman herself, I think, should check her breasts probably at least once a month.
And what should women look for?
So I think that a hard area, an area that's painful, an area that's red, or certainly if there's any discharge from the breast, like all of those things need to be investigated. Our breasts get tender and not tender and hard and not hard based on our monthly cycle. So you're right. I think checking them at different times is important. But, anytime that you question something, go get it checked out. Most women don't know what another woman's breast feels like. So it's hard to know if what you're feeling is normal sometimes.
And sometimes you don't even know what
Your own. Right.
Right. So it is important to check and to feel and to do it regularly.
Absolutely.
What, in terms of like what would you say is helpful for patients to do to be proactive in terms of lifestyle?
Oh, sure.
Because we know that the menstrual cycle can vary in throughout the month, and depending on different factors like diet, stress, physical exercise, you know, maybe
Yes.
you lifted something and you're sore in your breast, like should you
Right.
be alert, like, or you know, what kind of things should we look for, or what do you tell your patients that they should watch out for?
Right, absolutely. So I think, research shows that there are lots of lifestyle contributors to increasing your risk for breast cancer. And I think that diet is a huge one. I think that, staying away from processed foods, eating healthy, getting all the food groups in, I think are really important. Exercise is another huge one. Maintaining your weight is really important. There is also a lot of research that shows that women that are obese tend to have more breast cancer than women that aren't. So keeping physically fit and keeping your weight stable is a big reducer in your risk of breast cancer. Not smoking, not drinking too much caffeine, some of those things that you think are common sense, but you may not realize really do contribute to the development of breast cancer
And
as
maybe
well.
things, yeah, absolutely, maybe those kinds of things made me think of like just normal, like everyday life. Maybe
Hmm.
you're super stressed out, you're not
Hmm.
sleeping, so you need your caffeine, and maybe you smoke because you got to deal with life. So you're
Right,
already having stress, you're already low energy, so you need caffeine.
right.
Then you need to smoke to, have your little cigarette break
Right.
to deal with life. You're probably not eating well. So all those things just like can create a snowball effect, and
Absolutely.
trigger something
Hmm.
that may be dormant. And if you have a lifestyle that supports health,
Hmm.
then even if you have a gene that is dormant, it's not going to um, express,
Exactly.
because you don't have a lot of those things that will
Like a
expose
trigger.
the
Hmm.
genetic information, right? But maybe if we have the gene and we don't have the right lifestyle that support it, then it's going to give you a more, like, it's going to go towards a higher percentage of developing it.
Sure.
So lifestyle is a really important part of it.
Absolutely.
And I want to mention, you said weight gain,
Hmm.
and obesity can
Hmm.
trigger more, like add more to that percentage. And from the Chinese medicine perspective, that makes total sense,
Yes.
because the digestive system is highly related to the breast.
It's crazy.
The lines that run through our body, all these
Right.
channels that run through our body in Chinese medicine, they are each channel represents an organ system. And
Okay.
we look at the body in terms of systems. So the stomach organ system is not only in charge of digesting, but
Hmm.
also is involved in being able to to create energy in the body.
Okay.
If it's not well, then it can create phlegm, and
Hmm.
then therefore the stomach and the spleen start creating phlegm in the body, which then in turn can just be phlegm in general, like in the lungs, but also worst case scenario tumors. And so
Sure.
in Chinese medicine, phlegm can go to the severity that can create tumors. So if your spleen and stomach, your digestive system is not
Hmm.
good, and is not able to process the foods because we're eating the wrong foods, and instead the body's just like creating an inflammatory response that
Right.
it's just holding on. And we know that fat or adipose tissue is an area where all your estrogen is
Hmm.
held.
Right.
So you're getting bigger, you have more surface area of just keeping that estrogen, and most cancers in the breast tissue are due to an excess of estrogen.
That's right.
So in Chinese
Hmm.
medicine, the stomach channel runs right through the breast. and it's
Okay.
correlated in, not only digesting food and being able to process that phlegm, but also it can affect the breast.
That's
um,
amazing.
Direct correlation in there. One
Right.
of the points is actually right on the nipple. It's not a
Okay.
point that we use at all, but it is a point that is counted on, and it is so important in the body that our ancient Chinese masters had to put a name and a number to
Okay.
that part of the body. And it just happens to be on the stomach channel.
Wow.
Yeah.
Yeah.
So.
And also, I think that you cannot stress enough that having anxiety and stress and lack of sleep, how much it contributes to being unhealthy in general. And so, I think anything that can help like quiet that stress and relieve all those inflammatory markers that go crazy when your body is stressed can help reduce your risk of developing any cancer and especially breast cancer. Yeah.
Absolutely. So it's that epigenetics, right? Like what
Right.
we're exposed through our environment that
Mm-hmm.
we can control, the things that we can
Yeah.
control. And the
Right.
more of those lifestyle things that we can do for our body to run better, then we should, have a
Absolutely.
better chance of avoiding.
Absolutely.
What are the big side effects, let's say, that's more of like on prevention, what we just talked about? What about when someone has been diagnosed, and how does that journey start? Like, does it look different? And there's different options you mentioned,
Sure.
depending on how severe.
There's different types of breast cancer. So breast cancer is diagnosed by the type of breast cancer that it is. And some of that has to do with receptors of the breast cancer, like estrogen receptors or HER2 new receptors. And that helps guide the type of treatment that's appropriate. Of course, early stage breast cancers don't need as much treatment as someone who has a later stage breast cancer. So for instance, like an early stage estrogen positive patient may only require surgery, perhaps some radiation, and then go on to receive an estrogen blocker. Someone with a more advanced cancer or a HER2 new receptor may require chemotherapy. And of course, chemotherapy has lots of side effects that go along with it. Those that affect the stomach, like nausea, those that affect the nerves, like peripheral neuropathy. That's a very big one that can cause really a whole quality of life. It impacts quality of life.
Yes.
So,
And in terms of peripheral neuropathy, acupuncture and the type of treatments that I do here in my office are amazing at treating, especially the chemotherapy induced peripheral neuropathy, because once the treatment is done and the drug stops, then the body's no longer exposed to that neurotoxin. So that in my clinic, we have really high success with treating chemotherapy induced, because the body just starts regenerating the circulation on those nerves, and then the results are amazing, where patients can gain the functionality of their hands and their feet without having to live, like you said, that's a whole life long type of side effects that most people live with, and there's just gabapentin.
yeah, there's
Kinda
very
like,
limited medication is really not helpful. I find that stuff like acupuncture and meditation and things like that are actually better than any of the medications that are out there.
yes, we see that all the time with great success with that type of peripheral neuropathy
Yeah.
here. So, and it's stomach issues that can stem from there.
Oh yes, so nausea, of course, is probably the number one side effect of chemotherapy. And so, medications, of course, can be helpful, but I think that there's lots of other things that we can do for nausea too. There is, making sure that you're eating and eating good things like probiotic, like yogurt and things like that. I think that clearing your mind. I think your mind has a connection to nausea as well. I'm sure that there must be some acupuncture points that go
There
along
is.
with
We
nausea.
actually help our patients when they're going through their journey during their chemotherapy treatments.
Right.
Especially the beginning, like the first round, and everybody has different schedules, but like
Sure.
right after, that's where like all the nausea and everything is
Absolutely.
the highest. And so through acupuncture, like you said, helping with calming the mind, which is a big part of just going through, no matter if like your day of chemotherapy or not, is tough on your mind, it's tough on your nervous system.
Right.
And the nausea as well, like helping to points that are amazing at helping to lower that side effect and getting your and helping to support your body through it to keep you as strong as possible,
Right.
throughout.
Yeah, yeah.
Something that we definitely do support. In terms of diet, I know you mentioned yogurt, and that's a big part of like getting your probiotics. But actually, like in Chinese medicine, we talked about phlegm earlier.
Right.
Yogurt and dairy, that actually triggers more phlegm.
Oh.
So it's actually something that I
You
hear.
frown on it.
Yes, because I
Okay,
hear a
good to
lot.
know.
Yes, because I hear my patients a lot that they've been recommended the yogurt because
Sure.
those are natural probiotics and
Right.
it's great. But the thing is that when the body is in the state of already, having that phlegm, as in like the tumors,
Right.
digestion is not working properly because you're going through treatment, so your body's already weak, your body's already struggling in creating energy,
Okay.
on top of the treatments. And so in addition to that, adding something that puts more of a burden, right,
Right.
for the digestive system to break down.
Okay.
Yogurt and dairy actually creates like more trouble.
That's so
And so having
crazy.
a great probiotic, right, will be more efficient than just getting it through the foods at that stage.
Would you recommend stuff like fermented foods then? Like
Fermented foods
kimchi
are
and
better.
things like
Yes,
that?
yes.
Okay.
Like sauerkraut, kimchi. I wouldn't recommend well, kimchi is more, sometimes it can be very spicy.
Okay.
I would recommend staying away from spicy, but
Sure.
doing some, like, there's some mild kimchis.
Okay.
But staying away from the spicy food, from from the dairy. And a big one, also a really big one, is the cold foods like salads.
Oh.
A lot of patients think like, oh, I'm eating salad, and they think they're getting their greens or their vegetables, and it's
Right.
actually healthy. I mean, compared to pizza, it is
Right.
a better choice. But
Right.
again, that is a type of food that takes a lot of energy for your body to digest.
Yes.
So avoiding those things, and like cold drinks, ice cold drinks, right? Those are the same thing. It's gonna lower the ability of the digestive system to function.
Okay.
And one of the most important part, if not the most, is keeping digestion really strong. Because by keeping digestion strong is how your body generates your everyday energy, right? So if we take away those foods and then we implement foods that are warming in terms of like soups and maybe stews. We're in Florida, so it's hot and humid. I would stay away. I tell my patients to stay away from red meats and do more of like chicken broths and things like that
Right.
with the vegetables. Maybe like a rice soup that will give you like a complex carb, but like a carb that is natural instead of like pasta or something like that,
Right.
that would be a lot more effective, and it's nourishing for the patient to help
Sure.
them through that journey. A probiotic that is high quality, right? That is able to sustain like the acidity in the stomach. Not a lot of
Okay.
the over-the-counter probiotics are really, just labeled, but you're
Yeah.
taking something that doesn't get to where it needs to be, and so you're kind of like wasting time and money, but
Sure.
having a high quality probiotic
Is
is
there
also
one you
very
recommend
effective.
in particular, or
Yeah, I mean,
that I could pass along?
the higher the amount of CFUs,
Yes.
the better
Okay.
probiotic. And
Okay.
there is about 6 main strains of bacteria
Right.
that we want to look for,
Okay.
and those are going to be the more effective. Also, probiotic is not the only thing, because as you know, that's just the bacteria.
Sure.
But we need to feed the gut bacteria,
Right.
and that's where
Right.
eating your vegetables, right,
Okay,
come in
good.
handy.
Okay.
Or your prebiotics, right?
Okay.
So having, maybe if like appetite is really low, having a prebiotic in
Mm-hmm.
addition to your probiotic. So at least you're feeding the good gut bacteria, and you're maintaining what you're putting in with the
Right.
probiotic. So
Right.
that's where the vegetables are like, why do we have to eat vegetables? I have a lot of patients that are like, I don't like vegetables. And it's like, well, then your gut bacteria is not getting fed. And I joke, and it's actually like the truth. Like, we need to eat not only for us, but the gut bacteria
Right.
that's inside of us. Is like, what
Right.
do they
Sure.
like? Who's yelling? Who's craving? Who
Right.
I can't stop thinking about sugar. Well, that's actually your gut bacteria that is like, telling you we need more. So it's like, who do you want to listen to?
Right.
Right? Who are you really eating for is our gut bacteria.
Okay.
So that's a really big one
Yeah.
to help patients through.
I think that people discard how meaningful it is to eat well in a lot of ways. And, I always say that no one needs donuts and potato chips and cookies. I mean, nobody does. They're not nutrition. I mean, they may, people think that they're going to lose weight with chemotherapy or on cancer therapy, and so they have to pack in the calories. And it's true that we don't want you to lose weight, but we don't want you to replace nutrition. You still have to maintain good nutrition, and the
Yeah.
vegetables and the fruits, all of that's so important. So
Yes.
important.
Actually, today I was talking to a patient, and it happens very often where patients are like, I'm really big on the stomach, no matter what I'm treating, right?
Okay.
Eating the right
Yeah.
foods. And I'm like, did you eat? And they're like, well, if I eat, I gain weight. And it's
Right.
like, well, maybe you're not eating the right foods,
Right.
right? Because we should be eating to nourish ourselves.
Mm-hmm.
And when we're eating the right foods, we're actually, most of the time, you're gonna lose the weight,
Mm-hmm.
because you're actually eating the foods that are gonna nourish you, and
Right.
then you're no longer feeding the bad bacteria that is creating more and more adipose tissue or fat. So you're gonna
Exactly.
have the opposite effect. If you're gaining weight, you're focusing more on the wrong foods,
Right.
So I always have to like have the talk with my patients, because I think we think that healthy means being skinny sometimes and not eating, or
Right.
eating salads.
Right.
But
Mm-hmm.
that's not the case. I think food is really, really important, and eating the right foods is not going to have the effect
Right.
of the weight gain.
Exactly.
But what would be like the number one thing that can help patients to be more aware of breast cancer awareness?
So I think one of the biggest things is, remembering that you have to get screened. You have to
The
have,
screening.
getting mammograms. Y- y- there are a number, or let me backtrack and just say that, for instance, like a breast mass has to be a certain size before you can actually feel it. Where imaging studies can see things that are a couple of millimeters. You may not feel that, or you may have dense breast tissue so that it's kind of stuck in between areas that you may not necessarily feel. So having a mammogram, getting mammograms done every year so that there's comparisons to see changes, I think is very important. I'm always surprised when I'll meet someone who, for instance, we had a patient a couple of years ago who was in her 50s and had never had a mammogram. And when she was diagnosed, she had late stage breast cancer already. And, who's to say whether she may have had a mammogram all along that that would have been picked up at a much earlier stage and potentially cured, and now that's not possible.
Time is
So,
essential.
yeah.
So in terms of screening, there's mammograms. Is that like the first, like the
Yes.
most effective?
Yes.
And then what about MRIs? How do they is it one before the other? Like if you get a mammogram and it doesn't, it's not conclusive?
Yes.
Do you have to have like an MRI or a CT scan or an ultrasound? How are those out of those four, or if there is more, which one is like more important, or which one doesn't work, or like how does
So
that?
typically what we start off with is what's called a screening mammogram, which is just like basic images of the breast. But if there's anything that the radiologist can't see clearly, then they'll do more views. So an advanced mammogram called a diagnostic mammogram. In many instances, they'll incorporate an ultrasound in with a diagnostic mammogram. More and more insurance is allowing for MRI of the breast, especially in someone who has dense breast tissue, because it can look at that soft tissue a little bit closer. So if you're doing a scale of 1 to 10 on imaging studies, I would say an MRI may be able to see things a little bit clearer. But for the average woman, doing a mammogram is enough.
In terms of radiation, is an MRI higher in radiation than a mammogram?
That's a great
know?
question. I'm
Okay.
not sure.
Okay.
There are different amounts of radiation with a diagnostic mammogram and a screening mammogram. A screening mammogram uses, I even wrote it down, cervisits. It's some fraction of measurement of radiation, and the number is 4. The average person gets 3 just being outside in the environment each year. So a mammogram is 4, so it's a little bit more exposure than you would get just in general living on the earth. I think an
For one whole
MRI,
year?
yeah. I think an MRI is a little bit higher than that. Dental x-rays are like way up here compared to
really?
mammograms. So in terms of radiation exposure, I think it's very small. And I think that the payoff of potentially finding a problem is greater than the exposure to radiation.
That's interesting that you said dental x-rays are higher in radiation
Than the
than the
mammogram.
mammogram, because you would think like, oh, I don't want to get
I know.
exposed to the
Yeah.
radiation of a mammogram, but you do go get your teeth
Yes,
screened
and they do the whole
yearly. Yeah.
thing, and it's yearly, and
Yeah. Oh, interesting.
so
I
I
did not know that.
know. Yeah.
Wow.
So I think that radiation exposure should be the least of your concern when you're going to get a mammogram. And then as for imaging studies, if there's something that's unclear in a mammogram or MRI, then we move forward with other diagnostics like a CAT scan. But those aren't appropriate for just screening. We start off with just a screening mammogram and then kind of go from there.
Are you familiar with patients like having thermal scans?
I'm familiar with those as well.
What do you know about that?
So I'm not too familiar. However, they are
Sorry to interrupt. In terms of like when patients go in and maybe they have a thermal, and then maybe you're like, okay, something came up, let's go further, and then like start your regular screening.
Sure.
How often have you seen, or if you've seen like any correlation between what they come in and maybe showing inflammation or lack of circulation in the area to like something coming up on like further screening?
So I can't say I've ever had a patient who's had a positive thermal scan that has had cancer. So I haven't seen it in my practice at all.
Okay.
I know that there are some places in the area in Central Florida where you can have the thermal scans done. I think that they are a tool to then start a conversation moving forward. Where do we look closer at what may have shown up on a thermal scan.
Mhm.
I know that they are supposed to point you in directions that maybe are showing you an area that is an inflammatory area.
Mhm.
But whether that equates to higher incidence of cancer diagnosis, I haven't seen that in my practice, so I can't really.
I think it's an interesting tool
Me
to like
too.
know just like palpation, right? To have
Sure.
that thermal information because that can give you an insight of maybe like an area that's not getting circulation or an area that
Exactly.
is inflamed that the circulation is just getting stuck, right? Creating
Mm-hmm.
nodules or things like that. So
Right.
it's an interesting tool.
Yeah.
In Chinese medicine, we can use points to improve circulation and
Mm-hmm.
improve circulation throughout the breast or like avoid from that stagnation. When there's stagnation there is pain, and
Right.
this is like a quote from ancient Chinese text, like when there's stagnation there is pain, when there's no stagnation there is no pain. So the
Mm-hmm.
goal of acupuncture is being able to help circulation flow without getting stuck due to maybe inflammation keeping it there and not being able to move or
Right.
resolve what the inflammation, what the cause of the inflammation is, or also not having enough circulation that is
Mm-hmm.
going to the area to nourish the tissue. That's also a stagnation that can lead to
Right.
pain or like cysts and things like that,
Mm-hmm.
fibrous tissue, right?
Mm-hmm.
So lack of circulation can definitely lead to a more serious thing. So
Right.
acupuncture
Right.
is really good at keeping that, and then also helping with stress so the circulation continues to flow. So having those tools kind of like give you an insight of what the
Right.
circulation looks like. I think it's like you said, like being able to open the conversation or
Right.
like a guidance to like
Sure.
what do I do with what's showing
Yeah,
up.
yeah. Do you use that in your practice?
I don't,
Thermal
but I
scan?
know some patients do
Mm-hmm.
come and
Mm-hmm.
they have those
It makes
scans.
sense.
So,
I mean, it definitely makes
mm-hmm,
sense. And, that's the whole basis of cancer, of any cancer, is a hyper a metabolic state. I mean, those cells I have uncontrolled growth.
mm-hmm,
So if you can keep that metabolic in balance, whether it's through acupuncture, diet, exercise, any of those things, keeping that in balance and keeping that inflammation down is
mm-hmm,
really, can potentially, you know, keep you from developing cancer.
mm-hmm,
So I think it's really an interesting technology. We just, it's not a, FDA approved
mm-hmm,
test, so
mm-hmm,
it's not something that we use in our practice, but I
mm-hmm.
do know that patients
I'm
get them
sure
done.
you've
Yeah.
seen patients that come
Mm-hmm.
with them.
Yeah. Yeah. It's
Awesome.
really interesting.
It's so
Mm-hmm.
interesting. What is the best part of your job?
Oh gosh, the patients, of course. No, they really are. I mean, that's the thing that, God, for years, people will say, "What do you do for a living?" And I tell them I work in oncology, and the first reaction, "Oh," everybody always says that.
Yeah,
"Oh, it
it's
must be so sad."
uh-huh.
The thing is, I mean, yes, cancer's terrible, but lots of people are cured of their cancer, and we get to participate in that journey. We get to help them. We get to
Mm-hmm.
help them feel better, walk them through all of the treatment and the survivorship and the aftercare. And you really get to know people. You get to know them on a level maybe similar to your practice as well, because you get to spend so much time with them
Mm-hmm.
that it's not like you see your doctor once a year. I mean, they come and they see you and they come
Mm-hmm.
over and over
You
and
build
over
a
again.
relationship and
Absolutely.
in their toughest and the happiest time.
Exactly,
Yeah.
exactly. And so really that is definitely the best part. What's the best part for you?
For me,
Mhm.
that as well,
Right.
the relationship with my patients and
Mhm.
seeing them actually like when I see my patients, it's very similar to you once your patient starts the journey, right? Because it's a
Right.
tough journey. So when I see my patients, most of my patients are in a chronic condition.
Mhm.
They've been in pain for many, many years.
Yeah.
And they unfortunately come to me when they have run out of options. And
Sure.
so the happiest part and the part that I love the most is that even though they've tried everything, even surgeries and they come to me in a state where they just don't know what else to do.
Right.
When the patient is committed to their health and they allow themselves to heal, the healing happens.
Yeah.
And that's where I'm here for it. I am
bet.
obsessed with acupuncture. I love being able to stimulate our body's own healing mechanisms because I mean, that's how we function, right? That homeostasis, that balance.
Absolutely.
And that is the basis of my medicine, that yin yang. We talk different language, but we are essentially, doing the same thing. Western and Eastern medicine.
Right.
We want to help the body get back into a healthy state. And I can do that through acupuncture, through activating those points that will help your body do what it innately knows how to do. Yeah. That's my favorite part. So cool. And then seeing the patients think it's magic because they didn't take anything. They just showed up and took a nap and they followed recommendations, and then therefore they're feeling better. They're able to do what they couldn't do before. And so that's amazing. What I love about it. It's life changing. Yeah. It's amazing. Yes. Anything else that you want to share to close off our amazing conversation? Because I think that we can go on and on.
I think really just the takeaway is, know your own body. Definitely don't be afraid to, ask if you feel something that doesn't seem right. If you feel a breast mass, if you feel an uncomfortable spot, get it checked out. Get your mammograms done every year. And knowing your family history can be important too. So knowing your family history, if there is family history, perhaps get genetic testing. So that your, knowledge is power. So if you know that there is some genetic connection to your cancer or your family's cancer, and that you may have a gene or a mutation that increases your risk of cancer, that you're proactive in staying healthy and doing things like diet and exercise and reducing stress to decrease your risk of developing cancer in the future.
So awareness.
Definitely.
Awareness is powerful.
It is.
That's actually what Bodhi means.
Really?
Yeah.
I did not know that.
Bodhi means awareness. And that's why I chose that name, because through that awareness, we can do anything, prevent anything, it's super important. I agree with you.
Great.
Thank you so much, Melissa.
Thank you
for sharing your knowledge.
Sure.
And having these conversations that I think a lot of people will find helpful, and
I hope so.
That we can maybe start conversations and prompt patients to seek your help, my help, and continue to improve their health and stay healthy. Thank you so much for coming in today.
Thank you.